Hey everybody, thanks for joining today's webinar. My name is Jonathan Suckling. I'm Manager of Health Innovations at Center for Aging and Brain Health Innovation. And today we're going to be talking all about the Spark program and how to submit a successful application to the Spark program. It's a live program right now when we are accepting applications. And so we'll talk all through what the program is, who it's meant for, what types of projects we're looking for, the funding available, and all types of things like that. Just to mention right off the top of the webinar, you can utilize the chat feature in the GoToWebinar platform. That should just be a toolbar on the right side of your screen or in the chat window. And you can ask questions to me and to our marketing communications team, who is standing by with the ability to answer all your questions. So if anything pops into your mind while you're listening to the presentation today, please just drop a chat in the chat box. Or send an email to info@cabhi.com if something pops into your head later, and we'll get back to you and help make sure that you're as well equipped and knowledgeable about the program as possible to make sure that you have the best chance to succeed. So we'll jump into things by talking about the agenda first. So we're going to talk about CABHI and our organization and what we do. We'll talk about some of the details that you should be aware of related to the Spark program. So things like who can apply, what are the themes, the innovation themes, and the challenge sets that this program has identified as priority, eligibility criteria and examples of past success stories, how to apply, going through the form and looking at the information package on our website and everything you need to be able to navigate through on that website. Important program dates. So I mentioned July 5th is the date to get your applications in by, but there's a number of kind of intermittent dates before the program launches October 1st. And so we're looking at projects getting started October 1st, but you can find out, when you'll be notified if you're successful or not. And we'll go over all those program dates once at the beginning and then once again at the end. And then we'll have some time for some questions, and so some FAQs as well as some live questions that will be fielded and answered at the end of the presentation. So what is a CABHI? What do we do? This is our mission and vision. We're a solution accelerator that started in 2015. Our mandate is to increase the pace of adoption, increase the pace of innovation in the senior care sector, in the aging and brain health related fields, to bring new solutions to market, to bring existing solutions to a place where they're validated and they're able to strengthen their product claims, and to bring validated and succeeding solutions across a larger jurisdiction and to help increase their spread and scale. And so we have a number of different programs, one of which is the Spark program, which is the earliest in our pipeline. But all of them contribute to our vision, which is where people are able to age in the most appropriate setting, maintaining their health in various respects as long as possible. And so we'll talk a little bit about what we've done in the past, but the Spark program is our current and active call. We have run 3 previous rounds of the Spark program. This will be our 4th. We've seen a lot of really great innovations and exciting solutions developed or utilized through the Spark program in the past, and we're excited to be opening it up for a 4th round and also our biggest round with up to $2.5 million available. And so just to right off the bat flag some of the important dates, again, make sure your applications are in by 5 p.m. Eastern time on July 5th. Successful applicants will be notified within about a month of that submission date after everything's gone out for review and screening. And that's when we'll go to kind of a phone interview stage, which is a new element of the program this year, where we're going to be, I guess, successful in making it through the full application stage. The phone interview is to get a little bit better understanding, to understand the project, and it's kind of the final interview before we announce who are the finalists or who's actually awarded funds for this program. And so that's the phone interview is with the shortlist, and so then the agreements to be signed mid-September, and the projects again starting October 1st, and all the contracting and project scheduling and all the final refinements and KPIs will all be done between the August 16th and project start date. So what is the Spark program? So Spark supports innovative products and practices informed by the experience of point of care staff. We're looking for innovative ideas, new applications of existing products, different creative solutions to common challenges that are faced by point of care staff. And this comes back to really the hallmark of the program is taking all of that valuable insight and knowledge that's only existing at the point of care, people who are engaging with older adults and their caregivers, persons with dementia on a daily basis, and who have amassed a significant amount of exposure and experience and understanding of what's working and maybe what's not working, and understanding some of the challenges that they face, and what are some of the quick wins or the easy ways to challenge the existing assumptions we have about delivering care, or what are some of the more different disruptive solutions that we have as well that address some of the common challenges that people are facing as well. So that's really the spirit of the program, and we're awarding $50,000 to projects over a 12-month period to develop and accelerate the development of their solutions and help bring them to older adults within their institution, with the idea that eventually, if things are successful, that we bring them to a larger audience. And so rolling them out across a region or a province or the country or even globally. And that's our mandate. That's what we're looking for. But start local, start with the people that you're working with every day, work with your team and develop a new solution or a new application of an existing solution to solve those problems that you're seeing every day. And again, the funding envelope for this program is up to $2.5 million. So that equates to roughly 50 projects if everyone requests the max. And so that's the type of portfolio that we'll be looking at to award for this program. And just a little idea of why do we do this program? What are the objectives? What are the things that we want to get out of this? Or in other words, why do we Spark? We do this for a number of reasons. The primary objective of the program is really to build capacity and spread this culture of innovation across the seniors care sector. Increasing familiarity with innovation, developing new innovations is the secondary. All three are very core to the program running successfully. But you can see to support the development and testing of solutions that are informed by point of care staff. So bringing those insights into practice, and using innovations to address some of those challenges identified. And finally, there's no lack of innovation at the point of care, but there is quite a significant lack of innovation opportunities and resources available to support the innovation that's happening at the point of care. And there's statistics that show that dozens of times in a shift, a point of care staff, a nurse, a PSW is forced to improvise and to come up with a creative solution to address a specific problem. And so this program exists to bring resources that can help create a more structured approach to solving that problem based on lived experience, and then help that scale across point of care environments within the country and across the world. So CABHI's innovation themes, these are the 5 priority themes that we've set for this program. We're looking for solutions that address each one of them, and you'll be evaluated on how well it's addressed and whether it's addressed just locally or better at scale, and whether this is something that we could really use your solution, if it's effective, to roll out across a large region and it would address this problem at the root cause. So to go over them really quickly, aging Indigenous and or rural populations. So this is a huge priority area, of course, one of the larger public health challenges right now, not just in senior care, but supporting the healthy aging of knowledge keepers or older adults in Indigenous and rural communities. How have you engaged the communities that you're working with? How are you understanding the needs that they have and engaging them in the process of coming up with your solution is very important to consider in that particular theme. Aging in place, so not just aging at home, but aging in the most appropriate setting of an older adult's choice to help maximize their independence and age in the most appropriate setting for as long as possible. Caregiver support, both informal and formal caregivers. One's pretty self-explanatory, making life easier for caregivers, helping them have access to the right resources and supports. Care coordination and navigation. It's a difficult healthcare landscape to navigate at the best of times, and so what types of solutions do people have or do they not have that they could use that would help them access the right the right care supports and utilize the existing infrastructure in the health system in the best way possible, and to alleviate that burden and confusion and kind of feeling of being overwhelmed when there's a new, say, diagnosis or a new kind of chronic condition that someone is managing. And finally, cognitive health, and this is kind of a theme that runs through the other 4 themes as well. We're looking for solutions that can impact people with dementia and their caregivers and move the needle on that specific area. And so cognitive health solutions can be things that identify cognitive health earlier, or that are meant for people to help, screening tests and earlier identification, but also solutions related to cognitive therapies and rehabilitation for brain injuries and things like that that fall within the cognitive health sphere. So these are the 5 challenge sets that we've set for the program, and in the application you'll be asked to identify very specifically why your solution that you're proposing addresses one of those themes. So we'll get into some of the eligibility criteria now to give you a sense of what we're looking for and what we're not looking for. So the solution that you're applying with must clearly address one of the themes that we just went over, and also demonstrate potential to make system impact if implemented broadly. So it doesn't have to achieve system impact within your project. It likely won't with $50,000, but what critical milestone is this solution trying to address or trying to prove in this smaller project? And then what is the plan? Reference in your application, what is the plan to make a system-wide impact that goes beyond your 4 walls? Even if it's not the primary focus right now, there should be some idea of how this would help you to achieve a greater reach if this project is successful. Second, the project must be innovative, and that depends a lot on the context. It depends a lot on the environment. But the idea here is don't reinvent the wheel. If something already exists, look at that solution. If it's not working properly, maybe ask why it's not working right now, make refinements, consider your audience, but don't reinvent something that exists already. And in the application, you'll be asked to describe what else exists right now and how people are currently solving it and why this is better. And so that's important to note, that you have to demonstrate a purposeful deviation from current practice and standard process within a senior care environment to satisfy that criteria. Finally, you can't be using a third party, or you can be using a third party solution. The idea is that it's adapted to the senior care context. And so depending on the relationship that exists between the innovator and the point of care staff, there may be a matching funds requirement. The idea in the more traditional Spark projects is that you're looking at off-the-shelf commercially available technologies and applying them in a new way that allows you to address a challenge. So think about using virtual reality in a way that benefits an older adult population by using VR as a therapy and a therapeutic tool, using off-the-shelf technologies. If there's a more close relationship with the innovator, then that's when it gets into the territory of potentially requiring matching funds, and those will be kind of handled on a one-by-one kind of basis. But that's the idea, is that we're looking for new and novel and creative adaptations that are utilizing that point of care experience to really fit the brand of the Spark program. So the applicant has to be one of these 3 types, which can be defined, and you can read the actual definitions on our website, but briefly, the point of care staff, someone that's engaged with older adults in a care giving or care providing sense, including allied health professionals, I think personal support workers, nurses, OTs, PTs, everything in that category. A point of care manager, so someone that oversees a team of point of care staff, or a point of care researcher, so someone who conducts research, but applied research is very involved at the point of care. And the idea, the common thread through all of these different categories, is that these audiences have a significant amount of experience in providing care or in understanding the needs of older adults. And so to be eligible, the applicant must be one of these 3 groups and must be working or researching at a healthcare delivery organization located in Canada, or a member of the Senior Quality Leap Initiative Network. And if you don't know what the SQLI network is, then maybe ask a manager or director, but chances are it's probably because you're not part of the network. But as long as you're from Canada, then you satisfy the criteria if you're working at a healthcare delivery organization or affiliate academic institution. So the project criteria, it can't involve things like basic research, primarily academic goals, existing programs or initiatives just to subsidize those at the host organization, capital investment in a portfolio of intellectual property, and we don't do pharmaceutical trials or incubators for startups. We don't fund those things. So just that's all the things that we don't do. Focuses on the development and testing of an innovative solution at a health delivery organization and a maximum of 12 months. And so when you're putting together your application, it's a 12-month program. Make sure that your goals are realistic for what a 12-month project could accomplish. And so it's $50,000. It can move the needle certainly and help you achieve a critical milestone. It's not going to do everything. And we look for projects from an eligibility criteria that stance that we're looking for them that are realistic in the goals that they set, and that they're not going to stretch out their organization's capacity to the point that the project is unsuccessful or that it needs to be extended significantly beyond the original timeline. So that's just one tip for when you're putting in your project plan and what the project milestones are is keep it realistic. Make it meaningful, but make sure you're not overextending the project team and setting yourselves up for failure. So how are our projects selected? So this is after the eligibility screen, which is done internally. We send it out to our external review panel, and they're looking for to give you a score in these 4 categories. And so the solution is 30%, and this is where you'll talk about why is this solution different than others, why will it work better than others, what current solutions exist and why are they not enough. And a tip here, just be creative, be innovative, be different than what's currently out there. Don't just have a kind of a Me Too solution. Look for things that are new applications or new. Doesn't have to always be a new technology, but why is this different and why is this kind of a unique approach to a commonly understood problem. Second is strategic alignment, so tying into one of our 5 themes. How well does it tie into one of our themes, and how does it address that theme at scale? So that's a really critical piece of that, is not just how does it address it at your institution, but why would all Canadians benefit from rolling out this solution across the country. Project plan is 20%, and so that's where you're going to list some of your key tasks and milestones. Again, keep it realistic, but really make the argument for why this funding is going to help you achieve a critical milestone, whether it's generating evidence to sustain it locally and then build upon that, or to develop a minimal viable product, or if you're looking to bring something into a new care context and do kind of a rapid cycle evaluation that leads you to some sort of a product at the end of that, then that's all, those are all good uses of the funds, but just make very clear what is the end goal, what does success look like is one of the questions in the forum, and defend how if a project was successful at the end, because that's what we'll really be the reviewers will be looking for at this stage. And finally, the project team. Why will you succeed? Why is this team close enough to the point of care that they understand the needs that are faced by older adults and caregivers, people with dementia? And how has the team taken those insights and applied it to a unique solution? How are they working together? Have they worked together before successfully? Maybe not on an innovation project, but in the past, have they worked together? It's all about making the case for why this team will be successful. And so these are our 4 evaluation criteria. They're weighted slightly differently, but they're really looking for solutions that are in the spirit of the program and that are unique, scalable, have the right tasks and milestones and the right team behind them to succeed. So these are just meant to give some context and some background and understanding of the types of solutions we've supported before and some of the projects that you can check out on our website. They've all had blogs written about them before. They've all had some coverage, and we like to highlight them just to give people who are considering applying a flavor of what a successful project would look like. And so it could be something like designing a new approach to providing care to older adults. So this brings up the Toronto Hears program, which was a project at Baycrest done by Marilyn Reed, who's an audiologist. And the whole project was about bringing existing technology, so low-cost hearing devices, pocket talkers, CS50s, kind of amplification devices that are much less expensive, $50 to $100, rather than a $4,000 hearing aid. And so bringing that to an audience that kind of falls in the cracks of not being able to afford expensive audiology equipment, and using community centers, so partnering with community centers in Toronto to roll out those hearing devices, as well as an educational program and kind of a follow-up treatment plan to bring that to as many older adults as possible. And so that was a good example, again, of leveraging existing technology and using it in a way that brings it to a new audience. And so that's an existing project that we've supported. Developing a new product or service to address an unmet system need. And so an example of that is a project done by Ben Hartung, who's an advanced practice nurse at Baycrest, who came up with a workshop for nursing students that looks at the stress and the burden that new graduate nurses especially, but nurses in general, are facing when they come into working in a senior care environment where they're facing ethical quandaries like when is it appropriate to withhold truth, or when is it appropriate to use distraction methods to get out of a situation where perhaps a resident or a client has asked a question that answer to which might be disturbing or might cause grief. And so how do you handle those types of situations, and how is that related to staff turnover? And so putting that into a workshop that people can go through to strengthen their own efficacy and feelings of ability to handle challenging situations like that. And that's another example of a great Spark project. Testing the clinical application of a technology that interests you. And so I kind of alluded to this one earlier, but a technology like VR, which has been on the hype cycle for maybe 10 years now, but we're now starting to see some really interesting and sustainable applications of VR in a senior care context, and actually using it with seniors with some level of cognitive impairment was the purpose of this study. And so it was looking at whether the project or whether the technology would be accepted by the audience that was getting the actual technology used with them. And so they're trying to see if having the therapeutic content displayed, so natural settings like waterfalls and fields and things like that, would be calming, and would that eventually maybe be able to be used instead of drug therapy. And so that wasn't the purpose of the project, but now understanding through that project that that the technology was received well by the audience, they've entered into a larger project that CABHI is also supporting, where they're actually looking at more of the clinical outcomes against a control group and doing more of an RCT study. So again, they set a good milestone of saying, we just want to understand if this group of people with cognitive impairment can accept this technology, and then we move on to our next milestone. And that was an effective project plan strategy. Finally, adapting a validated innovation for use with a new audience. And so this was a project at Briere where the researchers were looking at using an existing product that had been used for physical rehabilitation with an older adult audience. And so the program was using a webcam that maps human movements onto a virtual interface or onto a screen, kind of in a virtual environment where it prompts you to make certain moves and to raise your arms and to move your legs and to work on your mobility, to pick things up off the ground. And it gamifies that in a way that they're able to track their progress. It's highly engaging. And again, the innovation was that this had been used in other contexts and other groups with other types of populations, but now bringing it to a population that was dealing with stroke or Parkinson's, and understanding the benefit of a project and a product like that to that audience was the purpose of the program. So I encourage you to read through some of the different success stories and examples that we've got listed on our website. There's many of them, and they illustrate where these projects were successful in putting together a project that was both beneficial to older adults, but also helped the project team to achieve a critical milestone that they helped to use towards their journey forward and towards sustainability and scale. So just a quick note on the evolution of the Spark program. Like I mentioned, this is the fourth round that we've done for Spark. The first round was the funding, and we had our structured checkpoints and the final report due at the end, but we've built on it quite a bit since then. And so the second iteration of the program, we added acceleration services that are available to the project leads. So things like our seniors advisory panel, which is kind of like a support or a focus group on demand for our projects to come in and solicit feedback from, or our marketing and communications support, where they can create, help them create content and blog stories and draft different narratives around their projects, which help them gain exposure as well as communicate their message to stakeholders. Commercialization and knowledge mobilization support were added. So that all happened in the V2 era. And then moving on to V3, we really tried to focus on strengthening the community of the Spark program, putting together a newsletter. We have a podcast now where we've done a number of episodes that are relevant to a Spark project that's going through the program and going through the innovation process. And we have an expanded service offering now, which includes things like design thinking or research design or how to get ethics approval and things like that. And so now that brings us to the fourth round, where we're going to be rolling out a curriculum to the projects that are selected for this cohort, where they'll be going through an optional curriculum that is going to look like monthly kind of webinars or group learning environments, where we talk about common challenges to the innovation process and how to go over those, and how to use your network and use supports in your within your network to get past those barriers and to make sure that you're setting yourself up for success. And so it's really meant to just be a group learning environment. You'll share things with one another. You'll learn about other projects, and that's a new feature of the program. We'll have guest speakers and people coming in as well to talk about what the actual application of some of these lessons are, and some stories from the past as well. We'll have past Spark projects presenting for this. And the idea is that these lessons will manifest in actual artifacts, actual documents, and plans and strategic documents that you can use to bring your initiative forward. So we'll coach you through that. It'll be a lot more of a hands-on support approach for this round, but again, it's entirely optional. And so that's something that we're building right now, and we're excited to roll out for this new cohort. So back to the task at hand, which is applying. So you can check out our website and look for the little button that says apply to Spark or apply for Spark, and you can read the information package, which goes over all of the things that we talked about today, as well as a little bit more specific information on the eligibility criteria and the selection criteria and the process. And you can also find all of our different documents, the letter of support template, the contract template, so you can look that over to make sure that that's all good with your team, with your management and legal. And then you want to make sure you submit that application by 5 p.m. on July 5th Eastern time, and then that will trigger the review process, and we'll get back with the results in about a month from there. So you can check out our Blitzen form, and I'll pull it up just for reference right now. And so you can just go through, check out the form right here. We have all the questions that you can go over, going through which categories are weighted how much and how you heard about the program, all things like that. If you have any difficulty with the program, with submitting your application, make sure just to go through and email the listed contact in the application, which is Sunny, SHAN at CABHI.com, or you can email info@cabhi.com to make sure that you've got all the information you need to submit a successful proposal. And so again, just to recap the dates, we'll be doing the phone interviews on August 6th, kind of through that week or two. And so once the successful applicants have been notified on August 2nd, we'll be setting up 15-minute interviews with chosen applicants. So just to make sure that you have all of your team available, or someone on your team available for those dates, to make sure that we can ask some questions that the reviewers might have posed, or just to understand what the objectives and the intent of the project is moving forward. And then we'll be notifying finalists shortly thereafter, and the projects again start in October. So that's all the talking about information related to the Spark program I'm going to do. I'm going to get to some questions now. And so I've got a few questions here from the audience. So the first question is, what does KPI stand for, and what does it mean here? Good question. So key performance indicator is what KPI is referring to. CABHI has a framework of KPIs that we have our projects report on a quarterly basis that tells us things like how many people you've engaged, how many presentations you've done, and it helps us just kind of keep track before we get the final report of how many people have been engaged and what type of attention and success the project has had, what type of traction it's had in its network, and how many people, highly qualified personnel might be involved in the project, things like that. So it's a good question, and that's something that you'll find out about after we send you the document with all of our KPIs. It's not going to be particularly relevant for the application process, but it's a good question. Can the solution be delivered in a home setting? Absolutely, yes. So we've had community care agencies apply before for Spark. We've had people working out of healthcare organizations that are maybe hospital-based but have a community service component and involve working out in the community or working in the home with older adults, and so that would be eligible, absolutely. Can a researcher academic apply? How? So the answer is yes. A researcher can apply. Someone who is a researcher would have to be involved at the point of care. And so it would be more of translational researchers, people who are engaged with an older adult population and maybe oversee certain implementation studies or technologies being introduced into practice at the institution level or in the community setting. So a researcher can apply, but the money would flow to their organization, which could be an academic institution, a university of some sort, but it would have to be approved that the work would be taking place at a place where care is actually being delivered, so at the point of care. So yes, a researcher can apply. Can we access this webinar on the website? And yes, they will go up over our Spark webpage, so you can go over this and listen back to any of the details that we've talked through after the presentation is complete. A couple other questions, and I think we have time for just a few more. Can we submit multiple applications? The answer is yes. You have to have the capacity to do all the applications if you're awarded all the applications. And we only allow for one solution per Spark round. So if you're applying for the same thing with multiple applications, you can't double dip or kind of stack the deck with the same solution. So we have a cap of one solution per organization, or rather one solution per Spark round for a particular solution. Who signs the letter of support? So the authorizing signatory should be the individual at your organization whose permission is required to take on the project. So this could be a manager, director, or a VP, but whoever is putting together the application should make sure that they're the person that they report to, the person that they would need their permission to be working on this for however often per week is in approval of that, and that's what we're looking for in the letter of support. It doesn't have to necessarily be the CEO of the organization if that's not who you report to. Innovations limited to dementia only? That's a good question. So innovations should be limited to dementia insofar as they have a dementia application. They don't need to specifically address dementia, but you should reference in your application why this would be beneficial for a population with dementia or their caregivers, right? And so it's not just about addressing the specific cognitive issue of dementia, but the support services around it. How do people who are caring for those with dementia get their information is a solution that addresses dementia. So make sure that there's some application and some benefit for people who have dementia, but not necessarily addressing dementia directly. Can a public educator apply where projects will enhance community supports? It's a good question. I'm not totally sure what would be meant by public educator, but if it falls into one of the three categories of criteria of either a staff manager or a researcher, maybe in a research setting, that might be, if the person's somewhat of a researcher, that would make sense. So I would say yes. I would say feel free to reach out with that one and just get a better sense of what your role is and how you engage with older adults, and that will tell us a little bit more about whether it would be eligible. I think we got one final one. So the project will be conducted at 2 sites should there be an applicant from each site. So there should be one primary applicant where the funds will be sent to their host institution, and it will be up to that institution to allocate the funds to any contractors, other parties, other sites involved. But it would be one primary applicant. That would be the point of care applicant, is the one that we would be working with and receiving all the communications, and their institution would sign off on the contract. And anything that happens within the project, so having another affiliate site or something, that would all happen between the 2 sites. So it would only be the one applicant. You'll reference the other institutions involved or the other applicants involved in the actual body of the application. And so that's how you do that. That has happened before, and so that is something that we allow, is to have other sites involved in a Spark project, just keeping in mind that it's $50,000, and then that stretches your budget a little bit thin if you're engaging people at different organizations, and just to keep that in mind. So I think we'll wrap it up there. Thanks again, everyone, for attending. I hope that we see your applications on July 5th. If you have any other questions, again, feel free to reach out to info@cabhi.com, and we'll get back to those as soon as we can. And thank you again, everyone, for listening.